The following video gives advice for trained screeners on how to carry out a drug and alcohol screen safely during the pandemic. We advise carrying out your own dynamic risk assessment before commencing any drug or alcohol screening. Most importantly, before any screen, you should ask the employee if they have experienced any COVID-19 symptoms in the last 7 days. Symptoms include high fever, a new continuous cough, sore throat, headache, or loss or change to your sense of smell or taste. If yes, do not continue to screen. Throughout the testing process, remember, wash your hands, cover your face, make space. Ensure you have fully prepared the room before conducting any testing. Make sure to wipe down all surfaces with a non-alcoholic antibacterial spray. Ventilate the room by opening a window or turning on any air conditioning. The testing room should be large enough to incorporate the socially distanced guideline of 2 meters. All necessary equipment should be available within the room before any testing commences. PPE. Before conducting any screening, ensure to wash your hands thoroughly using soap for at least 20 seconds. Wear a mask and ensure that it fully covers your nose and mouth. For every screening, put on a new, fresh pair of disposable gloves. Put on a face shield. Changes to the screening process. To avoid multiple hands touching the devices, ask the employee to select the device they wish to use in correlation with a number. Ask the employee to turn and look at a focal point on the wall. You must only break the 2-meter rule to take the sample. To take the sample, step in from the side of the employee and sample at arm's length. To ensure the tongue-in-cheek step is done correctly, ask the employee to pull down their mask so that you can monitor this part of the process. To take the sample, please follow previous guidance. Ask the employee to face away from you, look at a focal point on the wall, move in from the side and sample at arm's length. When conducting the alcohol screen, please follow previous guidance as well as ensuring never to stand directly behind the open end of the tube whilst the employee is blowing. Guidance for when the screening has been completed. Ensure all non-reusable equipment such as gloves and testing devices are disposed of using COVID-safe disposal guidance. This includes double bagging any equipment used and leaving for 72 hours for placing in the general waste to dispose of. Ensure any work surfaces are wiped down using a non-alcoholic based cleaner. Wipe down any common touch points such as door handles. Any non-essential equipment used during the test such as pens or keyboards should also be wiped down. Following any testing, both the screener and employee should wash their hands for at least 20 seconds using soap. For any further advice on testing safely during the COVID-19 pandemic, please call the office on 0800 371 898 or email sales@dtecinternational.com.